Ladies and gentlemen, thank you very much for the opportunity to speak to you today. I look forward, as you do, to the full report so that we can learn from the experiences of other European countries and consider how we can further strengthen patient involvement. Patient involvement is crucial, but it's also challenging. It's not easy for a government to oversee the entire landscape and support each patient individually directly. That is why in Belgium we've opted for a model in which we work through strong umbrella organizations for patients' organizations. In our country, the government indeed subsidizes the patient umbrella organizations, LaLuz and the Flemish Patient Platform. And thanks to their decentralized provincial branches, they are close to the specific patient associations and self-help groups for specific pathologies. This creates a vibrant network in which patients can share their experiences and concerns, whilst the umbrella organizations feed those signals directly into federal health policy. We've therefore also established a patient forum within our administration. And through that forum, patient representatives can make their voices heard directly by the leadership of our health administrations. In addition, they participate in key advisory and decision-making bodies, including those concerning the reimbursement of medicines and the quality assurance of our healthcare system. We apply the same philosophy to specific major policy initiatives. For instance, the new Rare Diseases Plan was not written for patients, but together with patients. Organizations such as Radio.org have actively helped shape the plan's priorities: faster diagnosis for rare diseases, greater visibility of expertise, better care coordination and accessible information. And their role does not end with the preparation. They also have a structural role in the implementation of the Rare Diseases Plan. The same applies to our new cancer plan. During a series of workshops, patients sat at the table alongside healthcare providers, researchers and policymakers. Their knowledge was considered just as important as scientific and professional expertise. Because good care is created when we develop policy together with the people for whom it is intended. Patients also play a central role in the endometriosis plan. Their experiences and concerns formed an important basis for the reforms being developed today for endometriosis. Patients actively participate in decision-making within various working groups and in the steering committee of the plan. In addition, we're also entrusting specific patient organizations with specific tasks. For example, case managers appointed through organizations for people with neurodegenerative conditions support patients and their families to retain control over their care. Finally, I would like to mention mental health care. As a matter of fact, we've been applying the principle nothing about us without us for many years already in mental health care. Patients and families are systematically involved in consultations, reforms, and evaluations. People with lived experience and participation coaches ensure that voices of patients are not only heard, but also actively shape policy. Patient participation is not an afterthought. It is a prerequisite for high quality, accessible and people-centered care. Only by working together with patients can we build a healthcare system that truly meets the needs of the people for whom it is intended.